An increase in the paternal's age increases the incidence of the mutated gene. A paternal age of 35 years old or higher at conception is associated with an increased risk of developing a FGFR3 mutated gene and passing it down to an offspring. Mr. Guy wants the quantitative data, and here it is. There have been little to no recent large population-based studies on the prevalence of achondroplasia. However, a study done in 2008 by Dorothy Kim Waller compared data from 7 population-based birth defects monitoring programs across the nation. At the time of this study, the prevalence of achondroplasia ranged from a low of 0.36 per 10,000 births in New York to a high of 0.60 per 10,000 births in Oklahoma. The study also presented data on the relationship between paternal age and achondroplasia independent from race and educational level. Fathers between the age of 35 and 39 years old had an adjusted prevalence odd ratio of 4.9, and those 40 and older had an adjusted prevalence odd ratio of 5.0. As of 2016, achondroplasia occurs in 1 in 15,000 to 40,000 newborns worldwide. Achondroplasia is equally common in both males and females, regardless of their race and ethnicity and age. Is there a cure for those diagnosed with achondroplasia? At this time, there is no known cure for achondroplasia. However, individuals diagnosed must routinely get their height, weight, and head circumference monitored. Growth hormones, femoral lengthening, and tibial lengthening are some known treatments to help with limb lengthening. The limb lengthening surgical technique is known as the Ilizarov technique. How is epidemiology being used to guide or inform prevention efforts for achondroplasia? Since there is no cure, and we know that the paternal age is a significant risk factor, the epidemiology tells us that it's important for expecting mothers and parents to routinely receive prenatal ultrasounds. Dr. Genevieve Bajat states that affected fetuses are able to be identified in the 3rd trimester of pregnancy due to abnormal ultrasound findings. Genetic counseling can also help assess the risk if there is a family history of achondroplasia. Genetic testing is another option that can be done before the birth to determine whether or not the infant has achondroplasia.